key takeaways here. Hypertensive urgency is not a real emergency. Stop freaking out. Tell your patients to stop freaking out. This is
Yeah.
one of my like little canned talks that I just have for the patient
Yes.
where I walk in the room and I open my mouth and I black out and this beautiful speech comes out and the patient feels
Birds
better
sing.
and birds sing and Snow White
Butterflies.
enters the
Yeah.
room and everything's great. Yeah. Um, Aggressively lowering blood pressure in your asymptomatic patients is a bad idea, which is a part
It's
of my
harmful.
little talk. I tell patients, I'd be a terrible doctor if I just gave you a medication through the IV and gave you a stroke, wouldn't I? And they're like,
Yes.
yes. Hypertensive emergency is a blood pressure reading plus end organ damage. It's not just the number. And you have to figure out what the end organ damage is if you're going to use that diagnosis. Treatment of that depends on the underlying condition, not just the blood pressure. And what's the last point?
Yeah, I like how you give it to me. No hydralazine. Don't ever do it. Hydralazine is awful. Stop. It doesn't do anything. I promise you will notice no change in your practice if you stop using it. As in, no effects will be missed.